Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, January the 13th, 2021, week 45 of the COVID pandemic here in Montgomery County. And today I'm joined by Commissioner Ken Lawrence. So today I am pleased to announce that Montgomery County is taking additional steps to set the groundwork to vaccinate more people who work and live in our county. Anyone who is 65 or older and individuals who have health conditions that qualify them for phase 1B or 1C can now pre-register to receive the vaccine on our website. The pre-registration link can be found at montcopa.org/COVID-19. And again, that's montcopa.org/COVID-19. And at the very top of that page, you'll see a green button that says vaccine information. Click on that and you will be taken to the proper page. You can also find this page linked on the county's homepage at montcopa.org. At this time, this pre-registration survey is not accepting responses from individuals who qualify for vaccination in phase 1B and 1C based solely on their occupation. We're currently working to address this issue and ask for everyone's patience as we continue to ramp up our vaccine operations. In the meantime, anyone who fits into the essential worker categories spelled out in 1B or 1C should contact their employer to see if they have completed the pre-screening for healthcare agency and phase 1B business vaccination registry, also found on that same webpage. As I have stated before, extremely limited quantities of vaccine are available. Montgomery County is still only vaccinating frontline healthcare workers in phase 1A. But I am so encouraged by the enthusiasm that so many people have to be vaccinated. And as I continue to ask you for your patience, I do want to share a graphic with you to give you a sense of where we are in this process. So the graphic before you has quite a bit of information on it. In that top box, first on the far left side, you can see the doses that have been received by Montgomery County. So far, as of yesterday's delivery, we've received 10,000 doses. By the end of the day today, Wednesday, we will have administered 6,510 of those 10,000 doses. So that leaves us with about 3,490 doses. At the Montgomery County Community College Mass Vaccination Clinic, we are administering 1,000 doses per day. So that leaves us with 4 days left before our next shipment. And by the time that next shipment comes, we will be out of vaccine. We've also estimated using the data of the people that have registered that we have about 10,500 individuals in the 1A category who remain to be vaccinated. Now, to give you a sense of what's coming next, we've pulled together just a few numbers of people that are in the 1B and 1C groups. So 65 to 74 years of age, based on recent census data, we have approximately 84,238 individuals. Then when we look at the group that's 75 years and over, we have about 66,793 individuals. If you take a look at the teachers and essential school staff, so we've asked all the public schools to give us their tier 1 teachers and staff. That totals 16,598, and that's just the public schools. We are still working to get that data from our independent schools. And then our police officers, who are also at the top of 1B, number 1,400 across the county. However, we are making progress. So in terms of total vaccinations that have been given in Montgomery County, so this includes the vaccinations that our hospitals have given to their workforce and to some members of the community, 18,352 people have been vaccinated in Montgomery County. As a percent of our population, that's 2.21% have received their first dose. And we have 1,442 people who've received both their first and second dose. And as you can see, that's a very tiny fraction of our population. So we will continue to update this chart just to give you a sense of how we're coming and the enormity of the job ahead of us. And as we continue to ask for your patience, just really illustrate how limited our supply is relative to the need. So because of this, we do not have a clear answer to when we will be able to start vaccinating people in phases 1B and 1C, but as quickly as we can, we will. So that's why we're asking and encouraging those that are eligible to pre-register now so that they can be notified as soon as additional appointments become available. Our Office of Public Health is reviewing the responses to all pre-screening surveys and will send a registration link to people that qualify. I do want to ask those that receive those links to please not to share them with family and friends. We have had several problems with people doing that, and individuals who don't qualify for the particular round of vaccination that we're in have registered for appointments, and if they do show up at the vaccine clinic, they will be turned away. So it's just an unfortunate circumstance all the way around. Again, we are right now only scheduling appointments for people in the 1A group. As a reminder, appointments are required to receive the vaccine. We're not able to take any walk-up registrations at the vaccine site. And as soon as we have more vaccine available, we will continue to open up more appointments. Now, I wanted to give a quick update on a very exciting project that we had been working on with our schools. And we talked a little bit about this a number of weeks ago, but it's finally coming to pass and is going live now, and is an effort to help keep our schools as safe as possible. The name of the project is ACEIT, and ACEIT stands for Antigen Testing Program in Montgomery County. The Montgomery County Office of Public Health and our Montgomery County School Districts have begun implementation of ACEIT. This is a collaborative Southeastern Pennsylvania regional effort offering in-school rapid COVID-19 testing for children and staff who become sick during the school day, and weekly testing for staff and high-risk students. It's voluntary and free of charge. By conducting tests on campus, school systems can use these tests as an additional screening tool in some cases to prevent the virus from coming onto campus, and provide another source of testing to which the school can quickly respond by removing an individual before they can spread the virus if they're already on the campus. Project ACEIT will offer in-school rapid testing from January 2021 until April 2021. This program primarily uses the Binax Now antigen tests, which provide antigen test results in 15 minutes, and they're administered using a self-collected nasal swab. Each participating school district is working directly with Project ACEIT and the Montgomery County Office of Public Health to develop and implement antigen testing that's customized to their school community. As of January the 11th, 2021, in-school antigen testing for weekly testing of staff and high-risk students has begun in the Lower Merion School District and the North Penn School District. Montgomery County Office of Public Health is beginning a similar in-school antigen testing program for private and parochial schools beginning at the end of January, but at this time, we will not be expanding to child care facilities. Moving on to our regular updates, since the January 12th press release, We have 270 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 37,918. These positive cases are a result of a positive test for the virus, not from the antibody test. 14 are from long-term care facilities, 1 is from another congregate setting, and 255 are from our community. 243 tests are from the last 7 days or less, 15 tests are from 8 to 14 days ago, and 12 tests are from more than 14 days ago. These positive individuals are from 42 of our municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 1 year old to 99 years old. And as always, you can check our maps at montcopa.org/COVID-19 for updated geographic and other information. Today, we have 150 females and 120 males. I am sorry to confirm that 7 additional Montgomery County residents have lost their life to COVID-19, which brings us to 1,087 deaths confirmed positive from COVID-19. These deaths occurred between December the 31st and January the 11th. This is an increase of 44 reported deaths since last Wednesday. 2 died in a hospital and 5 in a long-term care facility. Today's age range is 77 years old to 106 years old. However, I do want to note that yesterday we reported the youngest individual at 25 years of age to die from COVID-19 in Montgomery County. And today we report the oldest individual at 106. Overall, 564 females and 523 males have died from COVID-19. And again, they range in age from 25 years old to 106 years old. As you know, we do report the racial breakdown of individuals who have died from COVID-19. We report self-reported or family-reported racial breakdown as we have it. So as of today, we have 29 Asian, 6 Asian Indian, 4 Asian Korean, 130 African American or Black, 525 white, 391 unknown, and I'm sorry, I missed 2 American Indian or Alaska Native. Things are stable at the Montgomery County Correctional Facility. All inmates at the facility that have tested positive for COVID-19 are in isolation and stable without symptoms. I do want to announce that we're now conducting routine antigen testing on correctional facility staff in order to reduce the likelihood of staff or inmates contracting COVID-19 while in the facility. So here's a more detailed vaccine update. According to the Pennsylvania Department of Health vaccine website, as of this week, 7,500 additional doses of vaccine have been delivered to Montgomery County hospitals. Under the auspices of the Federal Pharmacy Partnership, 17 Montgomery County skilled nursing facilities had CVS or Walgreens host a clinic to administer the first dose of vaccine to residents and staff this week. I do want to clarify one thing about this partnership. This partnership is vaccinating, for the most part, skilled nursing facility residents only. The staff of the facilities, and in some cases, some assisted living residents, but they are not vaccinating, at this point at least, independent living residents. And we have told that, at least right now, we've been told that there's no plans to do so. So this federal pharmacy partnership has turned out to be very limited in the scope of who they are vaccinating. The county, I think I mentioned earlier, has received 3,000 doses of vaccine yesterday, bringing our total to 10,000 doses of vaccine received. In total for Montgomery County, 18,352 partially vaccinated individuals have been entered into the Pennsylvania statewide Immunization Information System, and 1,442 fully vaccinated individuals. Of this total, the county has administered, as of the end of the day yesterday, 5,397 first doses. And as I mentioned earlier, we'll have an additional 1,000 doses vaccinated by the end of the day, probably a little bit more than that, bringing our total to close to 6,500 doses. And these individuals are in the 1A cohort. I also want to note that there's a very small number of pharmacies in the county that are starting to receive some doses of vaccine. Other pharmacies have been approved but not yet received any vaccine. We've now added a map of vaccine providers that pulls data from the Pennsylvania Department of Health vaccine site. You can check that map at montgomery.org/COVID-19. You'll see dots on a map, and you'll see names listed on the left side of that map. Make sure that you click on those dots and check the facility information, because most of the approved pharmacies have yet to receive any vaccine. So don't get too excited if you see a pharmacy near you. Additionally, these pharmacies are supposed to be following the Pennsylvania Department of Health guidelines for whom they are vaccinating. So we are all supposed to be following the same set of rules. Moving on to our positivity rate. Our positivity rate has ticked up very slightly this week. Our 14-day average positivity rate is 10.45% as of Friday, January the 8th, compared with 10.40% as of Friday, January the 1st. So we've been effectively flat this week. As a reminder, a positivity rate below 5% is considered suppression of the virus. So you can see on the graph before you the daily positivity rates from December the 26th to January the 8th, and shows that we remain above 5% on all 14 of these days. In terms of our hospital data, as mentioned earlier, hospitalizations continue to remain high, but have improved slightly since last Wednesday. Today, 380 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This has decreased from 429 last week. 11%, or 42 of these individuals, are requiring a ventilator. Even though we have had a little bit of a decrease here, I had my weekly hospital call today. Our hospitals remain full, and many have had to cancel elective or non-urgent surgeries in order to have enough staff to care for these patients. So again, our hospital situation remains very tight, and everyone should be mindful of that. As a reminder, we have this information that you're seeing before you now on our data hub at montgomery.org/COVID-19. Moving on to testing, for the 14-day period ending January the 13th, 55,960 Montgomery County residents were tested. This is great. This is an increase of 3,734 people tested compared with the 14-day period ending January the 1st. So let's see what that looks like. We'll move on to our date tested graph. As a reminder, the gray bars are the number of positive cases on any given day, on that particular given day. The red line is the 7-day average of total cases. That means all the cases in the community and at long-term care facilities and any congregate settings. And then the pink line is the 14-day average of those total cases. The dark blue line is the 7-day average of community cases only. The light blue is the 14-day average of community-only cases. And then way down at the bottom, the orange and yellow lines are the 7-day and 14-day averages of the long-term care facilities. So next we'll zoom in to the last 10 weeks and note that both the 14-day and 7-day averages are moving upward, which likely reflects a post-holiday surge or increase. Thankfully, at least so far, this does not look like it's going to be what we had after Thanksgiving, which was an extremely dramatic increase in cases. So we are seeing an increase, and hopefully we won't get too much higher than where we're going now, but obviously that remains to be seen. We continue to have good availability of testing, and I want to urge anyone who wants or needs to be tested to get tested. Our testing sites are open Monday through Friday. There are varying hours each day at the different sites. This Saturday, January 16th, the Lansdale site will be open from 9 a.m. to 1 p.m. Registration for this site will open online at 7 p.m. Friday, January the 15th. One additional note, all county-run COVID-19 testing sites will be closed next Monday, January the 18th, in observance of the Martin Luther King Jr. holiday. To register for a test online, go to www.montcopa.org/COVID-19 and click on the green County Testing Information button. Appointments open at 7 a.m. on the day of testing, with the exception of the Saturday testing, where it will open at 7 p.m. the night before, the Friday night before. Phone registration is available for all sites Monday through Friday at 610-970-2937. Phone registration for all sites opens at 8:30 in the morning on the day of testing. There is no phone registration for the Saturday testing. Just an update on contact tracing. Due to the continuing very large volume of cases, the contact tracing team continues to prioritize contact tracing by prioritizing persons 18 years old and younger in order to help our schools, persons 65 years or older, and persons who are part of a community or household cluster. Also, if you were exposed at school or through a sports team or at your workplace and need to quarantine, your initial contact from the contact tracing team is now likely to be by email rather than a phone call. If you believe you may have been exposed through one of those locations, please check your email regularly. As a reminder, if you know that you've been exposed to COVID-19, you should self-quarantine. If you would like to be tested, you need to wait until 5 days have passed since that exposure. Getting tested more quickly than that will not be reliable. If you test negative after 5 days, have not had any symptoms, and have not had ongoing exposure to someone with COVID-19, your quarantine ends on the 8th day after exposure. So I just want to remind everyone that we continue to be in a very serious situation. We have many, many cases every single day. We are seeing deaths happening at a very high rate. We have not yet plateaued from the holiday season, and we certainly haven't started to go back down. So while we await vaccine, please remember the 3 W's. Wear your mask, wash your hands, and watch your distance. And with that, I'll turn over to Commissioner Lawrence.
Thank you, Val. I just have one quick update today regarding our PPE business support kits. As many of you may know, these kits are being distributed as a partnership between the county, the Alliance of Montgomery County Chambers of Commerce, and several Montgomery County municipalities. And these kits contain washable masks, hand sanitizer, digital thermometers, cleaning wipes, face shields, and social distancing signage. We've tried to streamline the process a little bit now, so any business in need of PPE should visit www.montcopa.org/commerce, and you can find a link to a list of the local distribution partners, which include many of our chambers of commerce and many of our municipalities. And these partners all have the kits on hand now, ready for pickup. And once again, these are available at no cost to the small business. Depending on the number of employees you have, determines the number of kits that you can get. So once again, you can go to www.montcopa.org/commerce. That concludes my report, Val.
Thanks, Ken. And with that, I'll just remind everyone that our next virtual briefing will be Wednesday, January the 20th at 3 p.m. And we're happy to take questions.
This afternoon, we'll start our questions with Jim Melwork from KYW.
I thought Carl was first. Yesterday, HHS Secretary Alex Azar blamed states for a lot of the delay in vaccine and pointing to things like micromanaging. Do you think micromanaging at the state level is an issue? And do you think his plan to open it up to 65 and above is a better way to do it rather than the current plan where 75 and above and how things are currently working with 1A, 1B, and 1C?
Well, all I can tell you with any accuracy is our experience here in the county. And we are getting dose from Pennsylvania Department of Health. They have told me when I have asked them that the number of doses that they get from Operation Warp Speed from the Trump administration is inconsistent from week to week. And so as a consequence, they can't promise us what we might get from week to week. But they are certainly sending us vaccine, and we are able to give every dose that we get. In fact, have the capacity to give a lot more than we have. And so our issue here in Montgomery County is not the ability to deliver the vaccinations, is that we don't have enough vaccinations to deliver. So, if we can just get more, we would be ready, willing, and eager to give it. And in terms of opening up the age range, I certainly understand why that is being done. And what we have to try to balance here is the fact that people at 65 years of age and older are absolutely at higher risk of serious disease and death if they contract the coronavirus. We have to balance that with making sure that the people in our hospitals, for instance, that would take care of somebody with coronavirus are also protected so that we have enough hospital beds, not just for people with coronavirus, but for someone having a heart attack or stroke or who's in a car accident. So we have to remember that we are knit together as a community. We have seniors that need vaccine. We have teachers that need vaccine. We have police officers and firefighters that need vaccine. And we have many essential workers that keep our hospitals open, our power on, our water running, and I could go on and on. So we really have to look at this as a community. It's fine to open up the age range lower, but we don't have any vaccine. I mean, I showed you the numbers at the top of this briefing. We don't have nearly enough vaccine to start to make an appreciable number of those folks able to get it. So I just hope that we receive more vaccine soon.
Do you expect or hope, or I guess, what are your thoughts on how things will change under a new administration, and how long do you think it would take for things to change under a new administration? Weeks, days, months? Any idea on that?
Well, I hope when the new administration takes office that there's just better overall coordination and communication. We can plan for anything. One of the things that's been hardest for us is that we just don't know what's coming. No one is able to tell us with certainty what's coming, even next week. I know we asked for 5,000 doses for next week. I don't know if we're going to get it. So I think better coordination and better planning and some certainty would be so helpful. If we knew with certainty how much vaccine we were going to get next week, then we could release more appointments for next week. So there's just been a terrible lack of coordination from this administration and poor communication. So I look forward to all of those things getting better.
And a couple kind of clerical questions. You mentioned someone's employer filling out the form for 1B and 1C. What if somebody, like me, for example, or a lot of people, their company is not in Montgomery County, but they are based in Montgomery County? Would their company still be responsible for that, or would they do that?
No, so they would do that. And so there's two options right now. If the individual's in a 1A category, There's language under the 1A survey link about how they should complete that survey as, what is effectively as if they were like a private contractor or an independent contractor. So they can absolutely, if they're 1A, go ahead and register as an individual. Right now, if they are if they would qualify purely because of their occupation under 1B or 1C, we were asking those folks to sit tight about another 24 hours. And we will have the ability for them to pre-register in 1B or 1C and the ability to check a box that indicates why or what industry they're in that would allow them to qualify in those cohorts. So we're not quite there yet. We wanted to get the registration up at least for those that were 65 and older and those that are under 65 that have a health condition. And so that's available right now, and then we'll be adding this other functionality within the next 24 hours or so.
And I talked to someone who filled out the registration, and they said they did not get an email acknowledgement. Are you supposed to get, as soon as you fill it out, an email back saying, "Hey, we got your registration"? Or
yes, it is set up to automatically send that email. So I would definitely ask them to check their spam account just to make sure it didn't go there. But if they did not get an email, then we do have an email address on our hub website. They should probably just send an email and let us know that they did not receive that email.
Great. Thanks, Todd.
Thank you, Jim. Next, we will go to Carl Hessler from the Pottstown Mercury.
Good afternoon, commissioners. Are you still at a point where you can't arrange for other community vaccination sites? Are you still at a where it can only be at the community college at this point?
Well, we are making plans to open a second location, and it potentially could open as early as January the 25th that week, but it is going to depend entirely upon how much vaccine we receive. Because right now we could give more than we're giving at the community college. And so it may not make sense to open up another site and have to decrease the amount that we're giving at the community college. So we're going to look at all those options, and we'll have a better sense next week when we know what we receive next week, and if we can get any indication of what we're going to receive the following week.
Are you seeing people from all over the county coming to the community college site? For instance, okay, so you are seeing people from, for instance, the western part of the county traveling to the community college site to get the vaccinations?
Yes, they are.
Okay. Are you at liberty to say right now what other area you are considering opening a vaccination site?
Not yet. I know sites are being scouted as I speak. And so as soon as we have that finalized, we'll be happy to share it.
Okay. Thank you very much. That's all I had today.
Thanks, Carl.
Next, we'll go to Deanna Durante from NBC 10.
Just jumping off Carl's point, the community college has a satellite site in Pottstown, right? Would that be of interest to keep it on the community college campus there?
It could be potentially down the road. Right now, we are more focused on the areas of highest population density in the county, just as a matter of trying to get as much vaccine as we can, as close to as many people as we can. We're working very closely with Pottstown Hospital in Pottstown, and they have, I think, largely gotten through their staff. And so they're looking at their ability to start offering vaccinations to community members in the 1A group, unaffiliated doctors or dental practices or home healthcare workers, that type of thing. So we're all working together on this, and they are looking to see what they might be able to do in that regard in the near term.
How or is there outreach or folks that don't have computers, folks that fit into these groups, especially as you get into the older citizens over 75 that are uncomfortable using technology? Not all, but just those that are. How do how do you kind of find out where they are and get them to register and get them to where they need to be to have this happen?
So we are working on a plan for that. That is a situation we are very aware of. So in the short term, certainly if seniors have friends or children or other relatives that could assist them in this task, that would be great, particularly if the senior does not have an email. Right now, the system is email based. So if there's, again, a friend, a family member that could put their email in, that would be great. We've also begun conversations with a number of our community partners who work on the ground in our communities all across this county every day to see if they might be able to help be that bridge to our seniors and help with some of the registration and appointment making and follow up. So we're exploring a couple of different options to deal with that very real issue.
Yesterday, when we asked Dr. Farley in Philadelphia about the recommendations from the federal government about increasing it to people over 65, he said that that could potentially be a dangerous situation because you tend to now make it a first come, first serve. And he specifically said you may have people who have more time on their hands or more resources to sit there and be able to register. And so he raised some concerns about opening it up this widely and the ineffectiveness, as he put it, to save lives. Because he says when something like this becomes first come, first serve, and you end up vaccinating people who have more resources, you're now doing the opposite of what everybody's trying to do and get to those underserved communities.
Yeah, I am very concerned about issues of equity as we continue to make vaccine available in our community. And as I mentioned earlier, that we have to remember that we are a community and that we have hospital workers and other frontline essential workers that are extremely high risk of being infected. And so we have to keep them up, hold them up and keep them in mind, as well as our seniors. Many of those frontline workers are from African American, Black, Latino communities that have been deeply impacted by this coronavirus. And so we are thinking about this very explicitly, and we are talking internally about how to manage just this next step, that as we do get more vaccine available and we finish up with our 1A cohort, how can we make sure that essential workers, frontline individuals who are being exposed every single day, they have no option to work at home, are being vaccinated, but then also, in parallel, also some older individuals who are at much greater risk of dying. It is a difficult problem, particularly given the extremely scarce amount of vaccine that we're receiving.
Any concern about the federal government just saying we're going to take those second doses we were holding back and then send them forward and release them? Because the plan was, if you gave out what you have, we'll back you up with the second dose, and the vaccine doesn't work as well or at all really without that second dose.
So we need to see some more data. I have the following concerns. When the clinical trials were done with the 2 vaccines that we have available to us now, we know from those clinical trials, and those were large clinical trials, and we saw that these vaccines are very safe and very effective with both doses. So after the first dose, those trials showed that people had about 52% effectiveness against this virus. But with that second dose, that's when we got up into the 95% range. So that's great. What we don't know from these clinical trials is how long can you wait for that second dose? And is it 6 weeks, 8 weeks, 12 weeks, 6 months? We just don't know. And whatever that duration is, we have to remember that people have about a 55% effective vaccine, not a 95% effective vaccine for the time period that they're waiting. So I'd love to see some more data. I'd also love to see some information about how Pfizer and Moderna have been ramping up their production. Perhaps there's more production than we know about, and that we will be able to get those second doses in a fairly timely manner. But again, I have that information. And so these are the things that I would like to see them be transparent about so that we understand what we're dealing with.
The vaccination site at the community college, do you have any volunteers doing that, or do you have a need for volunteers? I just spoke a little while ago with Delaware County, and they're putting out a call to have volunteers help staff their sites because they need people to locate at-risk people and to get the word out, and also just to help register. So how are you staffing that site?
Yeah, so we have a mix of employees and volunteers. We've had a very robust volunteer corps here in the county from the very beginning. They've been working at our testing sites and, in all kinds of ways. So if people are interested in volunteering, there's something called the Montgomery County Medical Reserve Corps. And if they go to our vaccine information page and click on the frequently asked questions at the top, there is information about the Medical Reserve Corps and how to volunteer. Now, despite its name, I want to be very clear here, despite its name, you don't have to be a medical person. That's just what we use to sign people up. So we welcome any medical person who would like to volunteer, but also any non-medical person, because there are many tasks that can be done at the vaccine site that do not require any medical background at all. But that is the way that we collect the information on people. And within the Medical Reserve Corps, we have a subgroup that is just for the COVID response. So people will get slotted into that, and then we will reach out to them as we need volunteers. We are definitely going to have an ongoing need for volunteers, particularly as we open up additional mass vaccination sites.
I have a couple of non-COVID questions. Do I need to wait to go through the next, or I don't want to hold?
Yeah, why don't we get through if there's any other COVID questions? Yeah.
Thanks, Deanna. I'll open it up to our other reporters on the line for a second round of questions.
Does that mean I can go now?
Sure.
Okay.
It looks like Deanna, go ahead.
I just had some questions about, as we get closer to the inauguration, after what we've seen at the Capitol, and what your words of caution are for people, things, a message you'd like to put out there, and what, if any, that you can discuss on security plans in the county. Are you looking at closing down the courthouse? Are you looking at closing down streets anywhere? What can you tell people about what the county's planning?
So I'll say a couple general words, and then maybe Mr. Saltesiak can give us a quick update on the county. If you are planning to go to Washington, I just want to remind everyone that there's COVID-19 in Washington too. And so wearing that mask, washing your hands, and washing your distance are just as important in Washington. I don't have any knowledge beyond what I've read in the newspapers about the security measures that are being put in place for the inauguration next week, but they certainly appear to be very, very robust. So, just all the normal cautionary notes. If you see something, say something. And remember all of your normal coronavirus cautionary mitigation measures and advice. And Lee, are you able to just do a quick update about the county?
I am. Yeah, we aren't aware of anything specific facing the county courthouse or any other county facilities. But our sheriff's office, our Department of Public Safety, the detectives, county security, we are all meeting internally and have been in touch with all of our external partners here in the county and regionally to share information. And we're also receiving information from other intelligence agencies just to keep us all abreast of the chatter. So we are staying aware of it, and we'll continue to update county employees as they need to be, but nothing specific or concerning as it relates to county facilities at the moment.
Thank you.
Next, we'll go to Jim Melwert.
Really quick question. When you're talking about the difference between 1A and 1B and the cutoff of age 75, is that a hard cutoff? If somebody is, say they turn 75 in a week, in a month, do they have to wait until they turn 75 to register? If they register now, would they get stuck in 1C? Is that just really too granular to have an answer right now?
Jim, I think you hit a new level of granularity. In 45 weeks it took you, but if they registered right now, they would be slotted into 1C because you're registered by your birth date. So that's really all I can tell you right now.
All right, I'll be honest. I'm asking for my mom, so that's a category. So
yeah,
that's all for me.
okay.
That concludes our questions for today.
Okay, great. Thank you, everybody. Thank you, Sarah. And we'll see you all next week.